So it's 7 o'clock and we're going to get started. I'm going to first introduce myself and then we'll introduce Kristen. I am Holly Farbo. I am the lead academic and industry relations manager of Hygiene. My job is to speak to students and build relationships with schools and students, talk to them about Aspen Dental and why it's a good choice, a career choice. So my background is I'm a hygienist. I've been a hygienist for 21 years. I was a private practice hygienist for 19 of those years, and then I came to Aspen as a hygienist in clinic. I worked for an Aspen Dental for a year and 4 months before this job came available. One of the main reasons I went to this job was because I saw how wonderful Aspen was, and I loved the way that we saw our patients, and I thought that that's the way that every office should be working, and I wanted to get that word out. So it was like a dream come true to be able to spread that word to students. So Kristen, I'm going to let you go ahead and introduce yourself and tell us a little bit about yourself and how you got to Aspen.
Well, my name is Kristen Nichols, and I am a registered dental hygienist. I work right now in our Horseheads, New York office. I became a hygienist in 2011. And I have been now with Aspen for almost 9 years. It'll be 9 years actually next month. And really that's basically my background with hygiene.
Great. Okay, so anybody that's joined, if you want to ask questions, there's a little Q&A button at the bottom. And you can just ask questions and I'll get to them. Some people have submitted questions beforehand, so you'll see me looking back and forth, and that's just me either reading questions or questions that are coming in. So the first thing I'm going to do is just explain a little bit about a DSO. Some people are unfamiliar with that term and what that means. Most people say corporate dentistry, and that sounds so cold because unfortunately it's looked on negatively. But what a DSO really is a dental support or dental service organization. So an example of that is if a dentist gets out of school and decides that he or she wants to open their own practice, the first thing they're going to have to do, unless they have somebody that they're going to take a practice over, is going to be looking for a place for their business. So they're going to need to get in touch with a real estate agent and try to find a place for their office. And then once they do that, they're going to have to set up their software. So you're going to have an IT person. You're going to, need to hire people. So you're going to have somebody help you with that, payroll, all of those things, and accountants for all of your finances. And then once that's set up, you need to find patients. So you need a marketing person. So generally, you'll hire somebody to help you do that. And then if the business isn't doing so well, you might hire on a partner, fire a financial, to try to get you moving there. So we take all of that out of that, and that's what we do on the management side. So I work for Aspen Dental Management. And so I work for the management company that does recruiting and marketing and all of those things so that the dentist and the hygienist can work solely on patient care. Our offices are owned individually by dentists. We are under the Aspen umbrella, so our offices are called Aspen, but each office is owned individually by a dentist. So they are, in so many terms, private practices because they have full autonomy to treat their patients the way they want to. So, Kristen, first and foremost, and I think this is important, is can you explain a little bit about the type of patient that we generally see at Aspen?
The types of patients that we see at Aspen, at least in my office, are patients who really haven't had care in quite some time. They're scared. They are embarrassed. They have no self-esteem. They don't want to be there. They're there because, well, they're in pain. And when they come through the door, it's our job to, number one, address the pain, treat them like family, and make sure they have a good experience at a dentist. Most of these people, haven't been to a dentist because they had a bad experience, and the fear has kept them away for so long. So it's always something new. It's always something different, but most of them are more of the challenging patients that we see in our office.
All right. So let's go over real quick about, we do things a little bit differently with our new patients. Most private practices that I've worked in, when a new patient's in the schedule, you may get a little bit of extra time, but you see that patient like you do any other. You take their x-rays, you clean their teeth, the doctor checks them, you go through that. So can you explain a little bit about our new patient exam and how that differs?
So what we do is it's a comprehensive care exam. So when the patient comes in, our dental assistants will take their x-rays. We'll bring them back into a room. We'll go over their chief complaint, their medical history, all of that. Now, this is even before anybody else is in there. My dental assistants then do what's called an iTero scan, where they can scan the mouth. It makes a 3D model of the mouth, as well as it takes a photograph of the mouth so we can see the gingiva. At that point, what will happen is I will go in, I will introduce myself, and I will do a full perio chart on that patient. As I said, most of these patients haven't had care. So we need to understand the gingival health before we can even move on. After I'm done and I explain what I'm seeing, and yes, the iTero is an amazing tool. It's the best thing Aspen's ever got. But I can use that tool because I can show them their gingiva and the health of it. And then what will happen after that, I'll go get my doctor. I'll come in with him. We'll go through what I found in the mouth, and then we'll go through the patient's concerns. The doctors then will look through all the x-rays, see what restorative, if there's anything that needs to be done, address that chief complaint. Then what will happen is they will actually get the chance to meet with our office manager. Our office manager goes over all of that in treatment, the insurance, all of it, so we can just focus on patient care. At that point, we will get them scheduled for their hygiene, because we believe in hygiene before restorative at my practice, and we'll get them scheduled. Now, that's not to say if I don't have an opening that day, we'll definitely get them in, but that's typically how the new patient exam runs from beginning to end.
So can you explain a little bit about how, like, basically an average day for you? One of the misconceptions is that we're a Profi mill, and people say that, and that you do Profi, 10, 12, 14 patients a day. Do you have a certain amount of patients that you have to see per day, or is that completely up to you?
That is completely up to me. You know, it's really my choice on how long I need for a patient. So my office, we're open for patient hours, 9 hours a day, which is a little bit different than 8. And I can have anywhere from an hour to 2 hours per patient. It really just depends on that patient's need, whether or not they are a true prophylaxis and their tissue is healthy, or whether or not we are dealing more with like a stage 3 perio, stage 4 perio, which is going to take more time. But as far as doing Profi, no, it's nothing like that.
Right. So do you have full autonomy for your treatment plan? And how does that conversation go with the doctor with the handoff to them about their perio?
So yes, when I go in and I am seeing, you know, radiographic calculus, probing depths, those sort of things, I have a very good relationship with my doctor. We communicate constantly. So when he comes in, the first thing I tell him is, okay, this patient has let's say it's stage 2 periodontal disease. The patient and I have gone over the necessary treatment in order to resolve the issue and try to get the mouth back into a healthy state. And then from there, my doctor will look at my chart, look at my x-rays, and then he will also, you know, express like the need, the importance and the urgency along with me so that patient can truly understand. Therefore, then if the patient has questions, both the doctor and I are in there and we can answer the questions.
Great. One of the other misconceptions, and I hear this about Aspen or, you know, DSOs, is that we have to sell to our patients. Can you explain a little bit about the products that you use and why, or, you know, how you go about that with a patient?
Sure. So no, there's nothing you have to quote unquote sell. Okay. So I have different products in my operatory that deemed on the patient need is what it is. Things I like to utilize. I have 1.1 gels in my room that I can give to patients who have sensitivity, who have root exposure, who are at a high risk of caries. I have MI paste at my disposal for those patients who their mouth is so acidic, or it's, you know, it's not looking good in there. That you can also give to children, which is it's great. We have, you know, I have dry gel paste. Those patients who have xerostomia, that's perfect for them. I have chlorhexidine, I have Stannis, I have wonderful Oral-B Geniuses. I wish everybody would get one. It makes your cleaning so much easier 6 months down the road. But as far as having to sell, no. The things in my room, these are the things that patients need. This is what I'm recommending to them so that we can get them to that healthy state. So they're not getting cavities. So they're not having to come back to the dentist more. They don't want to. So we can get them to that healthy state.
Yeah. And you know, what I love too, and because I was in private practice for 19 years, is the products that we have at Aspen are the same products I recommended to my patients on a regular basis. But now at Aspen, I have them right there to give to them. Because how many times do you tell a patient, oh, you know, this would be really great for you? Or how about doing this? Oh, yeah, I'll get it. They walk out, forget about it, never gets done. They come back. Oh, did you get that? Oh, no. Can you write that down for me again? Well, guess what? We don't have to do that, song and dance. We have it right here. And because we are Henry Schein's #2 customer, just behind the US government, we get amazing prices for our products that we pass on to our people. So they can get a product that I'm recommending for a lot less expensive than they could get at the store. So, I mean, that's such a nice thing. So what other services do you perform other than your cleanings and your scalings? What other adjunct services do you do there?
Certainly. So we do Invisalign. Which is something I do help our doctors with, which is great. Getting patients back into that healthy alignment makes it easier for cleanings in the long run. I do Zoom in-office bleachings at my office. I do Velscope screenings, which is an oral cancer exam. I know there's a few different types that are out there. My office used to use Visalite. We now use our Velscope. Let's see, I do, of course, impressions. I know most hygienists don't like to take those.
I always take them too. So
for, you know, if patients don't want to do an in-office Zoom treatment, we can definitely give them the opportunity to bleach at home before they get restorative done or before that, you know, big event coming up. So those are the things other than, you know, what you would expect to do as a hygienist that I do.
Good. Perfect. Real quick, let's get this question out of the road, because this is always something that people think and ask is, how do you get paid? Are you hourly? Do you get commission? Do you get sent home if you don't have a patient or have to clock out or work at a lower wage? How does that work?
No, we have a competitive salary that we get, an hourly rate that you get regardless of whether or not your patient shows or doesn't show. Yes, Aspen does have an incentive program, but that's just an added bonus. It's not, you don't base your salary upon that. No, you do not get sent home if you don't have a patient. There's always something that you can be doing. There really is. But no, it's not. If there's not a patient, you can go home for the day. So no, we don't have to worry about any of that.
And you know, that's another thing too. There were days where I would walk into a schedule that fell apart with 2 patients, but we had like 8 or 10 new patients in the schedule. And that allowed me to basically say to those patients, hey, you know what, guess what? I have an opening today. And some of those were my best days of patients who thankfully were very thankful that I was able to fit them in. So just at Aspen, we never look at those types of days as bad. We look at those types of days as opportunities to treat these patients now when they want to get it done. Because, you know, you will say most patients are used to going in and getting their cleaning on that same day. So we do get a little bit of resistance to that. So bringing that up, oh, go ahead. Did you have something to say?
Yeah. I did. And because I completely agree with you. There have been times patients that have come in and said, well, why can't I get my cleaning? And that is a question that is asked. And what I always tell my patient is, we don't know your mouth.
Right.
We don't know what your past history is. We need to get to know you, your mouth, and give you the treatment plan that you need so we can get you healthy. And once you actually sit down and explain that to patients, they understand. Now, if you can get them in, you're right. They are so grateful and so happy to get back on track.
Right. And, you know, we try to do that for the patients who have active disease process. Obviously, we know the quicker they start to get treatment, the better, which is, you know, always our goal. So how do you handle a resistant patient? Somebody who's maybe been going to the same place for 20 years and been getting a cleaning. And when they walk into your schedule, you notice bone loss and bleeding, and they're, you know, put off and saying, wait a second, I've only been ever told that I've only been getting cleanings. How do you handle a patient like that? What's your conversation with that patient?
So when they say it, you know, it does happen. The first thing I tell them is, I don't know your past. All I know is what I am seeing right now. I have the luxury in our operatories, we have computer screens that are television sets that we can actually pull up x-rays on a perio chart. The first thing I pull up, their perio chart. I've already explained to them what the numbers mean before I even go in there. Then what I'll do is I'll pull up the x-rays so I can actually visually show them, this is the tartar that is sitting under that gum line. This is where your bone is. This is where it should be. I don't know what happened in the past, but I am telling, you know, want you to understand that this is an active infection. This is an active disease. It doesn't go away. I don't know, you know, as I said, I would never speak poorly of anyone,
Right.
but at the same time, by educating that patient and taking the actual steps and time to explain it, they seem to understand. They're like, oh, showing them their x-rays, showing them their scan where that gum tissue is not healthy. Those visual things that we have at Aspen are phenomenal for explaining.
Yes, they really are. So this is a question I get all the time because I do work with students, and they're used to seeing one patient every 4 hours. So they're really scared about going into an office and being thrown into a schedule of patients. So can you explain a little bit about our training and what we do for for me? I mean, I was a hygienist for 19 years, but I still went through this training. Can you explain a little bit about the training and what we do when you first come
Certainly.
to Aspen?
Absolutely. I understand that. When I first graduated, I was scared out of my mind thinking I didn't have 4 hours to do a Profi. You know, it's the way you're trained. So Aspen has a program, it's called the Hygiene Orientation Program. HOP is what we kind of label it. And what it is, they're classes that you can take. Right now in the COVID world, yes, I know they're online, but you actually take them. They explain everything step by step. You are not thrown into the fire. That was my biggest fear. I was going to be thrown right in and just expected to run out of the gate, being able to do a patient every hour. But they actually take the time to break it down for you, give you the time that you need. We have the luxury of, we have people above us. They'll come in, they'll help, they'll teach you, they will work with you. Things that you may not have been super comfortable with in hygiene school, they'll work with you so you get to that comfort level. Once you're at that comfort level, seeing patients when you don't have 4 hours, it becomes so easy. But that program itself, they teach you everything that you could need. I remember when I went, I had never knew how to bleach teeth.
Yeah.
It wasn't something we were taught in school. And I was so worried. And they did a whole class just on, this is how you do it. And they had a model and you got to actually do it and see it. Or placing Atrodox. That's, you know, most of schools now use Arrested. Well, we have the luxury of, we get to choose either one for the antibiotic that we choose to use it. They did a whole class on, this is how you place Atrodox. So you're never alone. If there's something you don't know the answer to, between the HOP training, you can reach out and then you will get up to that speed. It becomes so much more comfortable.
Yeah, and that's what I love too about HOP, because if you weren't really sure or weren't really big into products prior, you really are after, because they give you they bring in these reps from these companies that show you the science behind it, and it's just so amazing to see that, and you really feel good. You know, you feel good about the products that we recommend to our patients and that we have on hand. So that's really amazing. So do you ever refer out patients for anything? Do you do,
Yes.
what kind of specialties do you have in the office? And when would you refer a patient out?
So for me, if I was to refer a patient out as far as hygiene goes, I do have a periodontist. If I'm looking at like a stage 4, I'm looking at 8, 9 millimeter pockets. Me personally, that's still not something I'm super comfortable doing. I'm just not.
Yeah.
So for that, I'd refer to my specialist. We do have an oral surgeon, amazing surgeon. He does come into our office twice a month, sometimes 3 times, and he can do sedation as far as extractions, or if a patient needs like crown lengthening or something along those lines. But as far as, we don't have like an endodontist, we would refer out for any root canals, things like that. But we do all crown, bridge work, implants. We do that, whether it be a denture supported implant or a, single tooth implant. So those are the things I refer for.
Great. And I will say that in some offices, we do have endodontists. It's office specific. We are looking, to expand that specialty into endo, and, for that. Also with the implants, a lot of our new doctors coming in are going through implant training as soon as they start, so that we can always offer that for everybody. So back real quick to compensation. A lot of the hygienists, are worried about benefits. That's not always offered somewhere. Can you explain a little bit about the benefit package? You don't have to go into detail, but what types of benefits are available?
Absolutely. We have medical, and I have family medical for my family. I have family vision, which is great. And we have a really, really good 401k. We absolutely do. The company offers a great 401k.
Perfect. So we're going to come up to COVID. That's been going on. Obviously, that's fresh into everybody's mind. So can you give a little idea of, number one, do you feel safe at work?
Absolutely, I do. Otherwise, I wouldn't have gone back.
Right. What are we doing at Aspen to keep our people safe, our employees, our patients? What's that look like as far as
Sure. So as far as for myself, I have N95 masks. I have level 3 masks I can put over them. I have disposable gowns. I have disposable head pieces. I know I look like a little lunch lady sometimes at work. We have our shields that we wear over my loops. We have every PPE you could imagine, and then some. We even have the booties for shoes. Yes. So as far as my safety, absolutely. As far as the patient safety, the things that we do different, making sure that things are being wiped down constantly. Our patients just don't walk through the door. There's a number on the door they have to call. They call the number. We call them back in when their room is ready. We're not having the waiting room being loaded with patients. Yes, patients have to wear their masks. I know it sounds funny, in a dental office until the doctor is ready and in the room, or until I'm in the room, and then they remove the mask. I have the luxury, my operatory has a door. I can close that door. If I do have to use anything that's going to produce those aerosols, if I am going to use something like that, I'm getting an assistant to come in and do like a high-speed evac. I want to keep myself safe, but I also want to keep the patients around me safe. And Aspen has definitely stepped up their game as far as patient safety goes.
Perfect. So real quick, I'm going to touch base on this, just explain a little bit. There's lots of opportunity at Aspen to grow. So beyond clinical hygiene, which is amazing in itself because it was my best job I ever had, there's lots of rooms to grow in Aspen. So we have different non-clinical roles that people can look into. Some on the side of the management side, but the territory hygiene managers and division directors. So these are positions of hygienists that are support system for the hygienist in office. The territory hygiene manager would be your next step up. So can you just explain what she does for you, or he? I don't know if you have a guy.
She.
What she does for you, because some people I think get under this impression that, oh, I have somebody standing over me and telling me what to do and yelling at me. But can you explain a little bit how she supports you?
Absolutely. So number one, no, they are not a teacher. They are not coming in to grade you. It is nothing like that, because I understand. I kind of felt that way, when I first heard about it. My territory hygiene manager, number one, my biggest cheerleader, my biggest supporter. When I have an issue or I have a patient that I feel like I can't get through to. I can reach out to her. I can't get something I need to order. I reach out to her. She comes into my office. Kristen, what can I do to help? What do you need done? Do you need vials of chlorhexidine filled for irrigation? Just, she is my biggest support. She's always there. It's like you're never alone. If you need something, that's who I reach out to, and she's right on it. And if she can't get me the answer, she finds the answer. So it's not like you have somebody like right behind you saying, you're doing that wrong, you're doing that wrong. It's nothing like that.
Right, right. So as far as your ordering goes, some people will ask me, like, can you order your own instruments? Can you order your own supplies? And do you have a budget? Can you explain a little bit about our ordering system and how you go about that?
Sure. So we do have an ordering system, which is great because ADMI handles all of that for me. I just have to pull it up. And whatever it is I need, yes, there is a budget. Okay. I mean, obviously there has to be, or everyone would order, crazy amounts of things
Yes.
and all weird flavors. But no, there is a budget that you want to try to adhere to. And yes, you're ordering your toothbrushes and your Profi paste and all of that. But the nice part about our order system, it is so much easier than anything else I've ever used because it's all right there. If you don't know per se, I want Floridex 1.1 gel, you can just type in 1.1 and it brings you up all the different types that you can order. And then you get to choose. It's not like you have to stick with this one company. No, you could get Prevident. You could get stannous fluoride if you don't want to use chlorhexidine. You really have the luxury of what you're comfortable with ordering that. Yes, you can order your own instruments. Not everybody uses the same instruments. I think we all use Barnhart's, but other than that, I mean, when you're talking about scaling instruments, everybody likes something different. Ultrasonic tips, everyone's different, and you can order them and get them in, and then you have what you need to get the job done.
Great. So another question I get is, what type of computer system, like software system, do we have? People are like, do you use Dentrix? Do you use EagleSoft? Just very briefly, because I know that's like a whole week of learning. But how is our software system?
Okay, so
what do we use?
Aspen has their own software system, and it is user friendly. I mean, dummy proof. Thank goodness. It is the easiest thing ever to use. It is literally click, voila, it goes in. It's nothing like, I struggled with EagleSoft. I'm not gonna lie. I don't think I could use it anymore, but you can set up your templates. So if you wanted to have a prophylaxis template for your notes, you can set that up and just enter in what you saw visually that day. So as far as writing notes go, saves me probably a good hour a day with this system. It is incredibly easy to learn. It's not overwhelming at all. And once you have it, it makes life so much easier.
Yeah, I liked it too. And, I will tell you, behind the scenes, it's amazing how much they really listen to their clinicians. Aspen really does. The things that the clinicians are saying that they need or want, on a daily basis, we are working on that to help your job be easier. So I'm just going to real quick touch on the metrics that we have. And again, people they get scared off by like all these numbers and quote, and okay, you need to be here and here. But can you give just like a brief overview of what the metrics that we have do for our employees?
So as far as the metrics go, the first thing I was taught is don't stare at them. Okay. Because yes, there are certain measurements in a company that they do have to measure. It's a company, it has to be profitable. But at the same time, the best analogy was given by Maureen House. She is part of Aspen. And if you drive looking down at it, you're going to crash. So you got to look up. So as far as metrics go, yes, it sounds all scary that, if I'm not hitting a certain number, no, I'm going to be in trouble. No. If you give the patient the care that they need and you see what's going on in their mouth and you take care of them, You don't even have to worry about a metric. You'll never have to look at a metric again. I don't look at metrics. I really don't. I used to in the beginning because I thought that's what you had to do. But then I realized that, yes, the company has to be able to measure, productivity and as far as budgets can go and things like that. But as far as me staring at them, no, just give the patient the care they need and you'll never have to worry about a metric again.
Right. And my territory hygiene manager used to say, do what's right by the patient and everything else falls into place. You never have to make up treatment. The treatment is there for these patients. And as long as you're treatment planning them correctly, and we use the AAP guidelines, we've all been trained on that. There's really you shouldn't have to worry about your metrics. Some days are better than other. Everybody understands that. And that's what I loved was I never felt pressured ever.
Yes.
I never felt pressured. I always felt supported. So let's go over a little bit. And you said that right now you are the only hygienist in your office, but you have had two, correct?
Yes. Yes.
Can you explain a little bit about the difference in like the lead and associate roles and how that goes as far as seeing patients?
So I was a lead when there were two of us in the office. As far as the lead goes, your job is you are going to be doing the ordering. You are also there for the other hygienists to help and support them. So the other hygienist and myself, we would try to, whoever we perio charted, because we've built that relationship. We wanted to make sure that they went into our chair if at all possible. But as far as, lead to associate, no, your job is to support, your job is to help. As a lead, yes, you will be responsible for ordering, and occasionally you will have to look at a metric or two. But, you're really just there to coach and develop, basically, the other hygienists. Now, if you have two very strong hygienists, it makes it a lot easier because you work as a team and you get the job done and it's easy. You don't have to think about it.
Right. And because our new patient exam is different, and we do have a new patient column, and then you have a treatment column that you determine who's in that column and how much time you need. Some people get a little intimidated by that. How do you balance your new patients and leaving treatment to go into a new patient? Like, is it just take time, or you have some way you do it?
So it does take a little bit of time to get used to, because in your head you're thinking, oh my goodness, I can't leave this patient. I'm in the middle of an SRP. I can't leave them. Well, number one, they were a new patient once. They understand that you're going to go give them the same care that you're giving the patient in front of you. As far as the way it works in my office, my assistants come and let me know prior to even taking x-rays. Kristen, we have an NP. It's going to be in this room. So then in my head, okay, I can kind of calculate time, how long it's going to take, about for them to take x-rays. I've worked with them long enough to do that dental scan, to do that medical history and make sure it's right. I can actually time it from that point and when I can give my patient that break that they may need. Some gingivitis treatments, it's a little uncomfortable. They may need a little break. Just you excuse yourself, and I have never in my 9 years had a patient be upset that I have left them to go perio chart. It's not like that at all.
Yeah, great. Thank you. Another question that students always ask about, and it's, they're real big into the community, community outreach programs and things like that. Can you explain a little bit about what Aspen does to give back to the community?
Certainly. My favorite day of the year, Veterans. We have a Veterans Day. I love this day. Our vets get to come in and they get free service, whether it's a debridement, because to do a full SRP would be incredibly difficult, but get what you can out of there, whether it's a Profi, a tooth pulled, a filling, whatever they're in pain for, or whatever, they need, they get done. Our office also chooses one vet that it seems we always have at least one that needs a lot of work. and we will do all of that work for them. And all of this is free of charge to them. They have done so much for our country, and we get to pay them back that day. So that's one of the programs. That's the one I am most passionate about. Sorry, I'm going to bring a tear to my eye. They're
Me too.
so grateful. It's amazing.
Yeah.
We also do the mobile mouthmobile, where we will actually go around the country and we will clean teeth. We do trips where I consider them, like, I call them mission trips. Sorry.
Yeah.
It's my background.
Yeah.
Where we go to Haiti, and you can go as a hygienist and you get to work with these people who have no care at all, and educate them and show them how to take care of their mouths to keep them healthy. So we do a lot of programs. I will go into the schools and educate a classroom, bring in toothbrushes, show them how to brush. It's being part of Aspen. You're not limited. You can do these different things to share with the community about oral health and make everyone healthy.
Right. And on the academic side, working with schools, I always tell my students, if you have a program that you're doing, I've done a 5K for oral cancer. I've done the smile train fundraisers. When they're doing fundraisers, me as an academic, I'm able to back them. Aspen has given, to these programs and allowed me to support them financially in some aspects to show, we value that kind of thing.
Yes.
So I love that part of my job. So how about CE? Do we get CE, or how does that work?
Yes. Oh, CE is so easy for all of you new graduates. It's so easy. Yes. Aspen does multiple things as far as CE goes. Number one, we do a lot with Viva Learning. It's great. But we actually do different classes where you log in, or right now in the COVID world, or we used to be able to go, and it's free of charge. Aspen pays for all of it. There's been continuing ed where it's 8 hours of your continuing ed, and you did it in one day. You never, ever will have to worry about trying to get your continuing ed. Aspen is always posting on we call it the bridge. It's our main site. And there's always CE on there that you can just go right on and you can register for. And it's super easy, and you'll never, ever have to worry.
Right. And, right now we are offering that to even non-Aspen clinicians. We're giving away free CE to everyone because we value hygiene. I think that's one of the biggest things that I loved about this DSO was that the value that is put on hygienists and our hygiene program. So you mentioned the bridge. So can you explain a little bit about what the bridge is and what that gives you access to and how that helps on your everyday,
The bridge is everything and anything you could ever need to know, literally, and then some. So the main page of the bridge, it gives you literally a whole drop-down box for anything. You can click on, I am a hygienist. My dental assistants can click on, I am a dental assistant. Our doctors can click on, it will break it all down. You can ask questions on it. You can order on it. It literally is the go-to page. Anything you want to know, it is there. And it is constantly giving us information about the company. So being a large company, sometimes not all the information is always communicated down the line.
Yeah.
So anything you want to know, COVID, what we're doing, what we need to be doing, those mission trips, they'll pop right up on that main page. So it's always being updated every day. I think it's something new on there. It's the first thing I look at in the morning. But yes, that's the best source of information because you can type anything into it and you can get an answer.
Yeah. And I love that too, because, a lot of times in private practice, you feel like you're on an island, like this little, if you have a problem or you have an issue, you don't always have, the dental community is small, but when you're in a private practice, sometimes you feel alone. Aspen is very large, but it feels like you're a very tight-knit group because you have access to ask questions on the forum. hey, what's the number to order this? Or what do you guys use for this? Or and you have all of these Aspen hygienists that, even though one might be in Georgia and one might be in New York or Pennsylvania, they feel like family,
Yes.
and that comes back to culture. Can you explain a little bit? We always talk about, people will say to me, what do you think give me a difference between you, Aspen, and another DSO? And I always say culture, because
Yes.
people don't realize it until you get here. Can you give
Correct.
it a little bit of an explanation about culture of Aspen?
So our culture is, we have what we call our mission, vision, values. There are statements. They're the words we live by. Okay. So in other offices, you don't have this. These words that we live by actually unite us, all of us as a family. You know, one of them, my favorite one, is we treat every patient like our mom.
Mm-hmm.
I want that. I want my mom to have the absolute best care. I want my patient to have the best care. We love a challenging mouth. Yes, we do. There's nothing more I love in our culture at Aspen is when a patient comes in and they're so embarrassed and they think it's over. That's it. And we transform their mouth. That is our culture. Our culture is to get that patient to the optimal health they can be at. But by these words that we live by, it literally unites not just my office, but all the offices together to follow through and make sure that it happens.
Wonderful. So we're going to talk about negative press, okay? Because you get that. And, unfortunately, one of the negative things about everybody being under the Aspen umbrella is that if there's anything that anybody wants to complain about, then they say, don't go to Aspen, and you see people complaining, or you see something happening. How do you deal with that? Like, how do you deal with other hygienists saying to you, oh, you work for Aspen, or, oh, you work for a DSO, or whatever? Like, how do you approach that or explain that to people?
The first thing I always explain to them is every Aspen is independently owned and operated. So you can't judge one by another. Also, we are huge. We are a big corporation, which means there will be some complaints, okay? It just is the way it goes. Unfortunately, in this world, we always seem to hear more negative than we do positive.
Right. Yes.
People are just more happy grumping about something than not. The next thing I always ask patients is, or not patients, but if like another hygienist was to ask me, what was the complaint about?
Yeah.
Was it about a denture? Was it about financials that they couldn't afford it? So when you have all this negativity, no, it's not like that. You're only seeing that part by looking online, or, that's one little piece of a huge puzzle. And that one little piece, that's okay, because all those other patients are getting the care that they need, and they're happy, and they've been with me for 9 years now. So
Yeah.
no, and it does happen, that negativity. But once you explain that we're all independently owned, it's more, they're like, oh, well, okay then, and that's typically, once I say those words, it's typically, oh, yeah, it's over. So
yeah. And that's, again, why I like to get to the students, because, I tell them to, and this is 100% true. You see people that say they've worked for us and it's terrible, this, that, and the other. But sometimes I always tell my students this as a mom and as a life lesson. Sometimes it starts with you. You have a negative attitude. You're not a team player. You don't want to have to do any extra help. You want to sit on your phone all day. You might not be good. And here's the thing. We want the best of the best. We want, like you, Kristen. I mean, you can tell your passion for your patients, and that Aspen has allowed that to come out in you. And there are lots out there that don't have that. And that's not the person we want working here. And when that does happen, unfortunately, sometimes, we have to part ways with people, because the type of person we want is you, the one who is excited about giving their patient that great care. And when you have someone like you have lots of good coming out of it, but someone wants to focus on this person who had a bad experience because of their own personal attitude and problems. And so when I start to tell people that, they're like, oh, that makes sense. Or you tell someone, denture patients, they complain because they have this high expectation. You and I talked about this.
Yeah.
They're like, and then a hygiene student understands that. They're like,
Yeah.
oh, that makes sense. So like you said, to ask a person, tell me what the complaint was before we get into this, and then we can go. So tell me what kind of so how many assistants do you have? Like what are the RM, office manager, like how is your office staffed? And what are their,
So normally up front, we have two, they're called PSRs. They're patient service representatives. They're basically the first face you're going to see when you walk through our door. At any given time, I can have 1 to 3 doctors. Today I have 3 doctors hanging out in my office. So we are a little bit larger of an office. As far as assistants go, we'll have anywhere from 4 to 6. It just depends. We do have an expanded function DA, which is great to have.
right.
We of course have our lab, which it's so nice to have a lab right there when that patient has a sore spot. Oh, it's so great. So my office is a little bit larger. As I said, we normally do have 2 hygienists. One is on maternity leave right now, so it is just me there. But our regional manager, he comes in quite often. We have 2 lovely ladies up front. We have an office manager, and she basically runs that ship. It's a ship. We're a family, and you got to make sure that everything's running smoothly. And then we have an assistant office manager, and they will handle, those new patient consults. They will handle the financing if patients need that, and payment and things like that. So my office, as I said, a little bit larger, but it's nice.
So, and I think that's one of the things that like a lot of they're afraid to talk to patients about price and stuff. But how do you approach price? Do you let that go with and say we have a staff member that will go over everything with you?
It depends. If it is a new patient and it is comprehensive treatment, no, I don't go into depth about pricing because I don't know their insurance, and that's not something I'm comfortable talking about because I don't know their insurance. Now, if a patient is in my room and their insurance has already been entered, and we're talking about, for example, 1.1 gel, because that is my go-to. I think everybody should use this toothpaste. It's neither here nor there, but I have no problem having that conversation of telling them the cost of that. Or I'm seeing bleeding and it's not normal. I want to do some irrigation in that quadrant. There is a cost associated with that.
Right.
I have no problem telling them the cost for that, or adding that one site of arrest in. As far as, I have no problem talking to patients about financials, just not the initial appointment where it's the big comprehensive package.
Right. And I think that, the comprehensive exam is something that may be different to people that they don't normally get. A lot of times, and from what I've heard from other people on our team, is like, as a private practice dentist, you don't always tell them everything that they have that's wrong, because you don't want to push that patient away. And you're kind of, some private practices are afraid to tell their patients that they need a crown. So they patch a tooth and patch a tooth. Now, not everybody does that. And of course, I'm only going by experience. But with Aspen, we do what you said, the comprehensive exam, which means we're going to tell you everything you need. We don't hold anything back because you need to know. It's your mouth. Why hold that back from you? And then wait till something really bad happens and be like, oh, yeah, we saw that. We just didn't want to scare you.
So patients, a lot of times, you're 100% right. They're like, but I'm just here because this hurts.
Right.
What I say to them is, I understand that, and we are going to address that. But tomorrow or next week, I don't want this to hurt.
Right, exactly.
So let's find out and give you a whole picture. We're going to start at the beginning, what's causing you the most stress and the most pain, and then we'll work down from there so you won't be in pain. And then once you tell them, explain it, they're like, oh, well, that makes sense. Yeah, I don't want this to happen again. So it's definitely, it's probably one of my favorite things about Aspen, that we do that. So patients have an understanding of what's going on in their mouth, and we're not doing patchwork, that they know.
And you know what, it's just so nice to hear you talk, because what you're saying and the way that you talk to your patients is exactly how people need to be and want to be talked to explain things to them, to give them the time and actually show that you care. And unfortunately, that doesn't always get done, And again, like you said, every office is independent. So each office is going to have a completely different staff. You're going to have a different hygienist, and you're going to have a different office manager. And, you know, it's a lot of times it depends on that. We try our very best to get the best people into those positions because, you know, we want people to care about their patients like you do. And that's also where the team HSs and like that, if there's an issue, it's always about communication. It's like that in any relationship. And that's what this is. It's a relationship with your office staff. You have to be a team player and you have to have a relationship, and communication is key. So, you know, you hear people, oh, the office manager was terrible. Well, guess what? Did you ever talk to that person? Did you ever sit down and maybe try to have a conversation? You know, those are just life lessons that people need to know sometimes. You know, I get on my soapbox here, being a mom.
It's good. It's good.
So we're going to wrap up here a second, but I have another question that I want to ask, and you can, you know, give me your take on this. And we say that Aspen is a yes organization. Okay. We say yes to treatment if we can. We say yes to breaking down these barriers. How's that impacted your career? Do you have a story of a yes today, or something that's really stuck with you with your career at Aspen?
Yes. Go figure, right? No patient leaves a mark on my brain. So I had a patient. I've been cleaning her for quite a few years. She has crowding everywhere. It's always a very difficult Profi. So we were talking and I asked her about, have you ever considered using clear aligner therapy? She's like, I can't afford that. There's no way. I can't afford that. And I'm like, are you sure? And she looked at me and I said, okay, long-term decay. I'm worried about the decay. And she's like, I don't know. And I said, okay, what we're going to do, I'm going to bring you up to my office manager. She's going to go over this Invisalign. So she goes up front and she meets with my office manager. My office manager comes back, says, we're starting this now. And I looked and I'm like, really? And she's like, we're going now. Are you ready? And I'm like, yeah. So we got her scan done. We, you know, got everything going for her. She was so excited. Now she is now out of her Invisalign. Her smile is beautiful. Her teeth are in alignment. And she came to me with tears and she said, Kristen, I can't thank you enough for talking to me about that and fitting me in.
Yeah.
Right there. It's worth it. Yes to today. Yes, you want to get that patient healthy. I've said this all night long. It's about getting the patients the care they need in the quickest amount of time. Now, can that be stressful sometimes? Yeah, but you're doing what's best for that patient and they're so grateful and their mouth will be so much healthier. So, but she's the one patient that just sticks out because she's like, if you didn't say, let's do this, I wouldn't have done it. So, and now she has a healthy mouth.
And that's very rewarding, and that sticks with you, you know, you're through your whole career. So, you know, I had a patient that she came in, she was in a wheelchair. Her daughter brought her in and she was from a home, and it was just one of these situations. And we literally made her dentures that day. And they were so incredible. And we were able to do that because at Aspen, we have a lab on hand. We wouldn't have been able to do that without that. But we said, you know what, we're not letting this person go one more day with all of her health conditions with nothing to do. And we made her dentures that day and she cried. And she looked so nice. And we all came in and told her how nice she looked. It was just such a feel-good day that to be able to do that for that patient is just amazing. And we have so many stories like that. So, you know, I want to thank you very much for being on with me tonight. It was really nice talking with you. And I hope to work with you again in the future, Kristen. Is there any last words that you want to say?
Listen, Aspen is a fabulous company to work for. It really is. As I said, 9 years in, they care about their patients. And honestly, as a hygienist, that's all you want. And they care about them and they care about you as a person as well. So
absolutely. And we're lucky to have you, Kristen. Thank you. Thanks. Have a great night.
You too. Bye-bye.
Bye-bye.